even having the weight of my comforter on my toe at night was painful.
We're here with patient Jeffrey, and he is now 1 year status post first metatarsal phalangeal joint implant. So we're going to go to the foot here and demonstrate that the range of motion is good and comfortable. The incisions have healed well. Now let's hear from him. I just heard his story. I want him to share it with you. Tell everybody what you have been going through for the past year and how this is holding up with exercise and everything else.
Sure. Surgery was done a little over a year ago, and progress was slow and steady at first, and it continues to be slow and steady. However, at this point, I'm back to my full complement of regular activity, walking about 2.5 miles a day. Just did Disney World with the family a few months back, where I walked about 30 miles in 6 days with minimal aggravation to the joint. There was a small recovery period of a day or so where the joint was a little more tender than normal, but overall the results were more than satisfactory. A little bit of swelling compared to the other joint on the other foot, but minimal based on the fact that we've replaced the joint in its entirety. Other than that, like I said, results are good. Range of motion is good. I can still have a little bit of prehensile in the toe.
Go ahead and demonstrate that again.
Yep.
I like that. Yeah, plantar flexion. Good. Very good.
And then the ability to roll my foot is somewhat diminished compared to the other foot, but overall more than acceptable for the activities that I'm doing, walking, running, yard work, things like that.
Preoperatively, obviously, surgery is indicated if somebody's in pain. How much pain were you having with it?
I was to the point where it was significantly uncomfortable to even walk. And then it got to the point before surgery where even having the weight of my comforter on my toe at night was painful. Just that little bit of weight from my comforter sitting on my toe. So it was, I would say, on a scale of 1 to 10 pre-op, it was probably in the 7 to 8 or 9 range, and now it's in the 1 to 2 range.
That's excellent. You'd recommend this procedure to somebody else that
Yes.
had a similar problem?
Absolutely.
All right. Thank you, Jeffrey.
No problem.